All right, today we're doing a deep dive into a really vital NHS role, but one that's often misunderstood. We're talking about the NHS Clinical Coder. Our goal here is to sort of bust the myth that it's just data entry. It's actually a high-stakes analytical career, and, well, we want to give you a clear roadmap on how you might get hired. Okay, let's unpack this. Think of the coder as a translator, really. They take all the complex stuff, the notes, the procedures, the diagnoses from a patient's stay, and turn it into this universal sort of alphanumeric data language, basically patient care into finance data.
Exactly. And what the sources really underline is that this is a highly specialized job. It's analytical, needs real intellectual effort and, sustained concentration. It really sits right at the crossroads of clinical practice, data management, and crucially, financial responsibility.
Yeah, like a detective almost, sifting through everything. You've got clinicians' notes, maybe handwritten sometimes, digital records, histology reports, imaging, all of it. And the coder pieces it all together to build this single, accurate clinical picture for that whole patient episode from admission to discharge.
And that accuracy is paramount because the codes they assign, they're the language the NHS uses for funding. So in hospitals, in acute settings, we're mainly talking ICD-10. That's for diagnoses, symptoms, conditions. And OPCS-4, which is UK specific, that covers all the procedures and interventions. Oh, and its NOM-TT is often key in primary care settings too. What's fascinating here is why it's so critical. This coded data, it's the absolute bedrock of NHS funding. It drives the whole national tariff payment system. You might have heard it called payment by results.
Right, so the coder assigns determine the healthcare resource group, the HRG, for that patient. And that HRG literally sets the amount of money the trust gets paid for treating that patient. So if the coder misses something significant, like a major operation or a complication,
then the trust gets underpaid, sometimes significantly.
Wow. So they really are financial gatekeepers for the hospital.
Absolutely. And it's not just about the money, though. That's huge.
Wow.
This data feeds into really important national performance metrics. Things like the hospital standardized mortality ratio, the HSMR, that's a big indicator of care quality. So inaccurate coding doesn't just hurt the finances, it skews our understanding of performance and affects planning, resource allocation, everything.
Okay, so it's clearly specialized. But here's something interesting. Trainee roles are hard to come by, right? Very competitive. So if you don't have a healthcare background, what's the single best thing you can do before you even apply for a trainee spot?
Good question. The key thing, really the must-do, is self-study. You need to complete courses in anatomy and physiology and medical terminology before applying. It shows commitment, initiative, and honestly, it fills that foundational knowledge gap so you can actually hit the ground running with the complex coding training itself.
Right, makes sense. You need the language before you can learn the grammar. Okay, so you get the trainee role. Then what? Here's where it gets really interesting, right? The big qualification.
Yes, the National Clinical Coding Qualification, the NCCQ, that's the gold standard. Passing it makes you an accredited clinical coder, an ACC. And it is tough, really tough. Especially the practical paper, you need a 90% pass mark. 90%.
90%, that's incredibly high. Why so demanding?
Think about it. Even a 10% error rate applied across millions of patient records every year. The financial distortion would be massive. The national statistics would be totally unreliable. The stakes are just that high. Accuracy is everything.
Understood. Okay, so let's talk strategy for getting that initial interview. Any high-value tips for our listeners? For you listening now, focus on your supporting statement in the application. Really nail it. Don't just say you have skills. You need to prove it. Use the STAR method situation, task, action, result, or GAR context, action, result. Provide concrete evidence for every single point in the person's specification.
Exactly, and link it to the NHS. When you're describing your actions and results using STAR or CAR, try to weave in the 6 core NHS values, things like commitment to quality of care, respect, and dignity. Show how your skills, like attention to detail, actually uphold those values in a practical way. That resonates.
Good advice. And once you get that ACC accreditation, what's the career path look like?
Well, ACC status generally moves you up to a Band 5, a senior coder role, and from there, it really opens doors. You can specialize further into Band 6 and above roles, things like clinical coding auditor, trainer, maybe even management.
So, summing up, definitely not simple data entry. It's a demanding analytical role, absolutely central to how the NHS operates financially and strategically. High demand, high stakes,
Which actually, this raises an important question, doesn't it? We've talked about the pressure, that brutal 90% accuracy target, the analytical demands of processing hundreds of complex, often sensitive medical records. So, how does that analytical requirement mesh with the emotional side? Coders see everything, trauma reports, details of severe illness. You need resilience, emotional maturity to maintain that intense focus and accuracy when dealing with such potentially distressing information day in, day out. It's a unique intersection of skills.
A really interesting point to consider. A challenging but clearly very rewarding career path.
Okay, that's our deep dive for today.